My name is Cassie Smith, and I will be talking to you about the disease Phenylketonuria, also known as PKU. As of the 1930s, PKU is considered a genetic defect because it has an amino acid metabolism disorder. The amino acid is phenylalanine, and it binds to tyrosine to make phenylalanine hydroxylase. If there is a block, then it causes PKU. PKU is a rare disease. It is also an autosomal recessive metabolism disorder. There have been over 500 mutations that has led to this defect in the levels of PAH activity. PAH is an enzyme that is an iron dependent on non-based meats foods. Most patients have had high levels of pH and tolerate less than 250 milligrams per day. There are 3 types of PKU. The first is classic PKU, which is caused by complete or almost complete deficiency in PHA levels. Moderate PKU have daily tolerance levels of less than 350 milligrams. And the last is mild PKU, which its tolerance levels are less than 400 milligrams per day. It is found that in the newborn screening article that 10% of children with classic PKU respond with BH4 supplements. This supplement is used for patients with this disease to help with the PHA levels. PKU is passed on from generations. It is also a genetic disorder which comes from the parent, which are the carriers. Newborns usually don't have symptoms at birth, but usually show them around 6 months. And the parents usually don't have signs, but they could have signs. As shown here, symptoms are on the face, flattened nose and face, upward slanted eyes, as seen there. On the feet, between the first and second toe, they're widely separated. On the hands, the last finger is short and it curves inward. For the person's face, most of the time it's light colorated, and then their eyes are usually blue or they'll have blonde hair. And causes are musty skin odor, skin rash. Later on in life, they'll have behavioral problems, convulsions, and the last part is for brain damage when it gets severe is mental retardation. Once tested, the doctors will talk to the patients and will come up with what they need to do. For babies, their testing is done with the heel of the foot, and this is called the PKU testing, and they put it on the sample sheet and they send it into the lab and get the results. Pregnant women can be tested while pregnant. Most pregnant women, if they have PKU, need to be on a low diet of PHE levels, and if not, their baby could come out mentally retarded. For the carriers, an unaffected carrier father and an unaffected carrier mother, it's unaffected 1 in 4 chance that they'll come out with PKU. Unaffected carriers, for both of them, is 2 in 4 chances. For the mother, if she's infected, is 1 in 4 chances that the baby will come out with PKU. I'll just start here. When trying to break down PKU, and in the normal PKU, we'll start with the normal. Normal PKU, once food is digested, it'll go into and break down into amino acids. The amino acids will then separate into phenylalanine and then have other types of amino acids. For the phenylalanine, it'll break down and become phenylalanine hydroxylase, and then it'll react and bind with tyrosine. If the person is affected with PKU, once it gets down to the amino acids, the phenylalanine will not bind with with the PHA, and it will just build up of PHE levels, and then it will cause health problems such as mental retardation and stuff like that. Once detected, doctors will start treating patients. They will work with dietitians and metabolic doctors. Babies will be on a special formula that has the right amount of levels of PHE and the right nutrition. However, mothers can breastfeed. When the child gets older, he will need to be on a low protein diet. as shown here, it says the mother can breastfeed. There will be no meat, no dairy products, no dry meat, no dry beans, no eggs, no nuts. And then they will have to take the BH4 supplements. Newborns the screenings cost between $10 to $140. For the organizations, they can stay tuned in with the AWHONN and most importantly the ACOG. And this will help to stay aware with the PKU disease. I hope this report has informed you on the importance of PKU awareness. Thank you.